Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Suxamethonium or succinylcholine. Succinylcholine is used by Bobet, and he received Nobel Prize for discovering succinylcholine. Ideal muscle relaxant. This succinylcholine is an ideal muscle relaxant for incubation. Succinylcholine onset of action of succinylcholine is around 30 seconds and duration of action of succinylcholine is less than 10 millimeters. Systemic effects of succinylcholine. Succinylcholine causes bradycardia. It causes hyperkalemia. Succinylcholine increases the intragastric pressure, intraocular pressure, and intracranial pressure. Even the oral anesthetic, that is inhalational anesthetic, even the intravenous anesthetic, which is ketamine. Intravenous anesthetic ketamine also increases the intragastric pressure, intraocular pressure, and intracranial pressure. Suxamethonium will cause muscle pains in around 40 to 50% of cases. These muscle pains can be prevented by pre-curization, that is giving one-tenth the dose of non-depolarizers before succinylcholine. If you give one-tenth the dose of non-depolarizer before succinylcholine, then this will decrease the myalgia, and also this will decrease the increase in intraocular pressure and intragastric pressure or intracranial tension. Fifth, masseteric spasm. Masseteric spasm is also a systemic side effect of succinylcholine because it mainly occurs because of the inadequate dose of succinylcholine. This masseteric spasm is actually a precursor sign for malignant hyperthermia. So, in malignant hyperthermia, the most commonly implicated drug in malignant hyperthermia is succinylcholine. Contraindications of succinylcholine. Succinylcholine is contraindicated in hyperkalemia because succinylcholine by itself causes hyperkalemia, so it should not be used in hyperkalemia. It is contraindicated in newborn and it is avoided in children, mainly because in children there is undiagnosed muscular dystrophies are associated with succinylcholine, and extrajunctional receptors are also, because of the extrajunctional receptors, it is avoided in children and it is contraindicated in newborn. In head injury, it is contraindicated. You should avoid succinylcholine in head injury. In glaucoma and eye injuries, it is contraindicated because succinylcholine increases the intraocular pressure. The succinylcholine is contraindicated up to 3 months after trauma, or 6 months after stroke, or 1 year after birth, mainly because or after birth, or 1 year after birth, mainly because in all these conditions there is extrajunctional receptors or immature acetylcholine receptors. And one more reason is it is contraindicated 3 months after trauma and 6 months after stroke because succinylcholine increases the intracranial tension also. Succinylcholine is contraindicated in renal failure because of increased potassium levels. Succinylcholine is contraindicated in advanced liver failure. Succinylcholine is contraindicated in prolonged infections, especially in abdominal sepsis. There is acidosis, and this acidosis will cause hyperkalemia. So it is contraindicated in prolonged infections. Succinylcholine is contraindicated in shock because shock can also result in metabolic acidosis leading to hyperkalemia. Then succinylcholine is contraindicated in low pseudo or atypical pseudocholinesterases. Succinylcholine is contraindicated in muscular dystrophies, especially because of hyperkalemia complication and for malignant hyperthermia. Because of these two complications, succinylcholine is contraindicated in muscle dystrophies.
Summary of succinylcholine. Succinylcholine is also called as Suxamethonium. It is used by Bovet, who has received Nobel Prize for discovery of succinylcholine. It is an ideal muscle relaxant of choice and which has onset of 30 seconds and duration of less than 10 minutes. Then systemic side effects are on CVS. It causes bradycardia, it causes hyperkalemia, increases intragastric pressure, intraocular pressure, and intracranial pressure. Even ketamine does the same. It causes muscle pains, that is in 40 to 50%. Muscle pains are prevented by precurization. By precurization, that is in precurization, we give 1/10 of non-depolarizing muscle relaxants are given before we give succinylcholine. This will decrease the muscle pains, also decrease the intraocular, intragastric, and intracranial pressure. It can cause masseteric spasm due to inadequate dose of succinylcholine. It is a precursor of malignant hyperthermia, which is most commonly caused by succinylcholine. Contraindicated in hyperkalemia, newborns. It is avoided in children, and it is contraindicated in head injury and glaucoma, eye injuries mainly due to increased intracranial pressure. It is contraindicated up to 3 months after trauma, 6 months after stroke, and 1 year after burns. It is contraindicated in renal failure because of hyperkalemia and advanced liver failure. It is contraindicated in prolonged infection because infection can lead to acidosis leading to hyperkalemia. It is contraindicated in shock, which again leads to acidosis and hyperkalemia. Contraindicated in low pseudo and atypical pseudocholinesterases, and it is contraindicated in muscular dystrophies because of hyperkalemia and malignant hyperthermia.
Thank you and thank you for watching.